Hi everyone and welcome. I'm Dr. Smart with Smart Skin Dermatology, and today we're talking about thread lifts. Thread lifts are very interesting. They've been around for a long time. They've gained a lot of popularity much more recently. And I want to talk briefly about who is the ideal candidate for a thread lift. All right. Now, the threads that are used in thread lifts, as we're talking about them today, are dissolvable threads. Much like suture that goes in under the skin and dissolves over a month's time, these threads are made of material that dissolve and stimulate collagen as they're dissolving. So the ideal candidate for a classic thread lift is someone who has heaviness through a zone of the face, either the jowl or jawline, typically, or the brow and upper face. What's done in a thread lift through local anesthesia in office, just injections of local lidocaine. The thread is inserted to the side or lateral face area, and under the skin it is threaded through the deep layer of the skin to the area that we want it to engage. Very frequently that's this zone. So inserting a thread here by the ear, that thread goes in under the skin and engages all along the way, but also at the destination point, and then provides some subtle degree of lifting like this. Now, the ideal candidate for a thread lift is actually someone who has a little bit of skin laxity, and that's important to differentiate between excess facial fat pad, either deposition or fall. So we're primarily dealing with skin. So when you're looking at the area on an ideal patient, they're going to have skin laxity that is more skin than it is facial volume. The threads don't lift facial volume nearly as well as they do simply a little bit of laxity. And that's another key component, number 2, of the ideal candidate, is that degree of laxity is mild. So the ideal candidate has mild laxity. And they are unwilling or not wanting to go through a much more invasive procedure such as a face and neck lift to get those results. Thread lifts do not get the same degree of results as a facelift, and they do not last as long. They're getting a mild to moderate lift on patients who have mild laxity through the lower face typically, or the area that's being lifted. And those threads will show or have lift for anywhere from 6 months to 12 months on average. So somewhere around a half a year to a year for that lift.